Hi there, friends. I'm posting this video today because we've gotten quite a few phone calls in the last few weeks from people who had COVID or they have COVID but they do not want to be seen for a visit. And so I want to explain why it's imperative that I see you for a visit if you have acute COVID. Number one, the symptoms are a little bit different with this strain that we're currently experiencing August of 2024 compared to 6 months ago. Some people are having fatigue or a headache, and that's it. No other symptoms, not congestion. However, the virus itself, including the spike protein, which is the man-made inflammatory part of this virus, gets into the system through usually inhaling. And that protein causes inflammation and it replicates for at least 3 to 4 days after you've been exposed and you're starting to test positive. When we treat you using specific protocols that have been proven to work, including ivermectin or hydroxychloroquine, including lemon balm in some cases, including appropriate doses of zinc and vitamin D and probiotics like lactobacilli and bifidobacterium, doses for you. So in other words, if you've done stool testing, I can customize the probiotic. If you've had a vitamin D or zinc level drawn, I can customize that. If we know your glutathione's low, we can customize that dose. So all of this depends on you. Everyone across the board can definitely do and should do povidone iodine diluted 1% in their nose at least 3 times a day when they're testing positive. Everyone should also do mouthwash, and on the FLCCC website, under acute care, they do talk about the active ingredients that make the mouthwash effective against COVID and the spike protein. The reason this is really important, instead of just letting it run its course and letting the immune system fight this virus and doing nothing and not even telling me about it or just seeing me weeks later for your routine care, the reason this is important is because this is not a typical virus. This is not like having the flu, in that the spike protein is different and it will continue to attack the lipophilic organs, the ovaries, the liver, the brain, for months after you're infected with COVID if you don't get the viral levels down pretty quickly during the first 3 to 4 days. Now, if you get COVID but you forget to call me and you call me around day 5 or 6 when we're going into the inflammatory phase of this virus, we're going to do some things that are a little bit different to calm down the inflammation. But the truth is that all patients I've seen that have long COVID or any of the other names that it's been given, it's really just untreated initial COVID. So they were not treated correctly or aggressively enough in the beginning. And the problem is we don't know if you're going to be those patients when you first have COVID. So I want to point out that I'm the one that can really help you decipher between symptoms. Is this brain fog because of the spike protein? What is going on with this bloating and this joint pain? Is it related to the spike protein, or is it possible that I have another thing that flared like Epstein-Barr when I got sick? But because I've been treating patients with COVID for 4+ years now, knock on wood, we still haven't had any hospitalizations or deaths. I can tell you I can tease out what is COVID and what is your other symptoms. And I'm asking that you schedule a 15-minute telehealth when you have COVID so we can talk through this and I can help decide what's the best thing in terms of your customized plan. Doses of zinc, doses of vitamin D for you. Do you need glutathione, ivermectin? And if you see me for that visit, you're much less likely to get long COVID because now you have treated acute COVID instead of untreated. There's not a great way when you get COVID. You can be not that sick, but then get long COVID. There's not a great way of us knowing when you first get COVID, is this going to turn into long COVID or not? Essentially, again, long COVID is just untreated COVID. We know how to treat COVID, but you got to do everything individualized to you. And that typically is hard when you're sick, when your brain is not working perfectly. So please see me for a 15-minute telehealth. I promise it won't be terrible. And if we decide on that call that you need IV vitamin C, we have you wear a mask, we have you come in or stay in your car in the parking lot, and then we give you an IV. And then you're much less likely to have long COVID. Thank you. Have a good day.